Good afternoon. Welcome to Here for Good, Israel Tech and Social Impact, brought to you by the America-Israel Chamber of Commerce and the America-Israel Economic Forum. I'm Scott Glickson, President of the Chamber, and for myself and Herb Krug, President of the Forum, thank you for joining us. We hope you're all healthy and doing as well as possible in today's challenging environment. The purpose of the Chamber is to promote trade and collaboration between entities in Israel and the U.S., and today's program is being held virtually to replace our customary Spring Innovation Award Dinner. The social impact theme of today's program is timely and significant. And after a few brief comments, I will turn the program over to our co-chairs and we'll get started. I would like to remind you to use our Buy Israel Goods program, which you can access by a link on our website, to identify sellers of Israeli goods. If you know of any vendors who would like to participate in the program, please have them contact us, and we'll be happy to add them to the list of vendors in the Buy Israel Goods program. Please also watch for the announcement of our upcoming programs, particularly our Business Leadership Award program in November, which will also be held virtually. Our Spring and Fall Award Dinners are our two major fundraising events of the year, and I hope each of you will consider a contribution to the Chamber or the Forum to support our efforts on behalf of U.S.-Israel cross-border trade. You can make your donation to either organization on our website, www.americaisrael.org. And if you're not yet a member of the Chamber, please join us and help us accomplish our goals. Now I want to take a minute to recognize and thank our sponsors of today's program. Howard Bernstein of the America-Israel M&A Link, and not so coincidentally, the founder of the Buy Israel Goods program. Scott and Lonnie Glickson, yep, that's me. Susan Rosenstein of Susan Rosenstein Executive Search Limited, our immediate past president. Len Ferber of Catton, Muchen, Rosenman Law. Our Crowd and Amy Stoken, and Hilco. Thanks also to Our Crowd for its invaluable technical assistance in putting today's program together. I also want to thank Michael Schmidt, our longstanding executive director, for all of his efforts on this program and throughout the year. And thank you to Amy Stoken and Len Ferber for their tremendous work in organizing today's program and recruiting speakers whom I know you will find interesting and informative. And now I will get out of the way and turn things over to one of the co-chairs of today's program, Amy Stoken of Our Crowd.
Thank you, Scott. Thank you for all you do. And thank you to everyone for joining us today and for your support of AICC. And thank you to my co-chair, Len Ferber. By now, I'm sure you're familiar with the term Startup Nation. You may also have already heard Israel dubbed Impact Nation. And you may have read the book by my friend Avi Jorish, Thou Shalt Innovate. To quote Avi, "There is no single narrative that fully describes the state of Israel, but there is also no denying that the country has extraordinary innovators who are bound together, not by religion, money, or stature, but rather by their desire to save lives and make the world a better place. Israeli innovation is making outsized contribution in bettering the lives of billions of people around the world by feeding the hungry, curing the sick, and providing shelter for the homeless. Today, we want to both celebrate and provide you with an opportunity to hear a bit about the amazing technology coming out of Israel at a time when the world could especially use some repair. There's also a relatively new concept, social impact investing. The idea is that by investing specifically in companies that are solving global problems, investors can achieve a win-win, helping the world and generating great returns. We also hope to educate you a bit on social impact investing in candid discussions with our speaker and panelists. Before we dive in, we are grateful to have Ariella Rada with us, Consul for Academic and Community Affairs at the Israeli Consulate for the Midwest. Ariella, thank you for joining us, and I'm now turning this over to you.
Good afternoon, everybody. It is absolutely my pleasure to be with you today, representing Consulate General of Israel to the Midwest, especially at such an event that highlights the very best aspects of Israel. I would like to thank Scott, Fred, Michael, and Susan at the Israel-America Chamber of Commerce in Chicago for all your work on promoting the Israel-US economic partnership. I especially want to thank and recognize the efforts of the event co-chairs, Len Ferber of Kirin Law Firm and Amy Stocken, the Midwest representative of our crowd. We look forward to hearing from our featured speaker, Richard Norman, Managing Director of Founds at our crowd. Our panelists, Bob Cheeb of Kaleidoscope Ventures, Bernard Hastings of RBGH, and Michael Levin of German 8 represent diverse aspects of Israel's innovation ecosystem and are all good friends of the consulate, and I'm looking forward to hearing them as well. I would like to mention just a few examples that only stretch the surface of Israel's contribution. A company named WaterGen can produce water from the air in places ranging from Africa to Asia to Flint, Michigan, where grounded water are non-existing or polluted. This invention provides a low-cost option to obtain water without a water system. Only yesterday, I participated in another webinar with 2 BIRD grant winners from the US and Israel, who jointly created a sensor that can be placed on garbage trucks, which analyzes the electric grid under city streets and can anticipate power problems that can harm a city before they happen. I was shocked to hear about all of the things that they're doing together. As you know, during COVID pandemic, Israel was very busy in several things, but one of the most important things is that several Israeli technologies, such as Magen app for contact tracing, T2Care for remote medical services, and Bayar for immediate symptoms identification, helped save thousands of lives worldwide. Israel is not only the innovation nation, but also the impact nation whose entrepreneurial creativity truly heals the world. I would have mentioned so many other activities and innovational companies that we have, but unfortunately, I don't have enough time. So I would like just to finish with a short description of what we do in the consulate. So in the consulate's 9-state Midwest region, our economic team, which I lead, is always on the lookout for US prospects for partnership with Israeli companies and institutions. Our main goal is to leverage our resources to make connections to bring both Israelis and Americans together to explore possible joint ventures. We're also a resource to keep you informed about those opportunities. And of course, you're more than welcome to reach out to us with everything that you need. So thank you, everybody. And thank you, Amy and the team, for the opportunity to speak here today. And I'm sure that you're going to enjoy the terrific program and outstanding speakers. Thank you.
Thank you so much, Ariella. Before we turn this over to our speaker, I just want to remind everyone that this webinar is off the record and closed to the press. If you have questions for our speaker or panelists, you may use the Q&A function in Zoom, or you may email questions to me at amy.stoken@ourcrowd.com. I would now like to turn this over to my colleague, Richard Norman, who serves as Managing Director at Our Crowd and co-heads Our Crowd's fund investments. He will join us right after this brief video.
Oh my gosh, it's all over the news. We need to fix this right now. Can't believe this is happening today. Why is nobody stopping this? There must be something we can do.
The impact revolution. Like the tech revolution before it, it's going to be driven by you.
The extraordinary energies of startups are needed now to tackle the global challenges we face.
inspiring, investing, collaborating will move impact forward. So many ways to make an impact. What's yours?
Hello, everybody. It's great to be here with you all. My name is Richard Norman, and I am the co-head of funds at OurCrowd, and I am also the resident in-house impact nerd. So I touch everything that we do at OurCrowd that's impact related. So just to give you a little flavor of what that means. We really feel at OurCrowd like we've been touching impact ever since inception, right? Just by nature of the types of companies that we're investing in, the types of companies that you just saw in that video, impact is really a huge part of our DNA. But over the last 2 or 3 years, we've decided to actually formalize that approach, appreciating that best practices in the impact industry have moved on so much that it would be irresponsible of us to be talking about impact and not really understanding what that means. So we partnered with an organization called Social Finance with their team in Israel. They're probably the market leaders globally in impact advisory and thinking about metrics and measurement. And we've worked with them to build a really smart sort of filter to think about impact investments, and then to also think about what you can actually do to help companies grow, measure their impact, think about KPIs, development opportunities alongside their business objectives. We summarized a lot of the research that we've done with SFI in a report we published last year. That was a very well received report on the state of the market. I'm happy to furnish that to people on the call who would like to learn more. And then we went and launched an impact fund together to give investors the opportunity to get high impact investments that are also, strong venture-backed businesses, again, the likes of which you saw in that video and that we'll talk about in a moment. But I think, if there's one thing in the short time that we have together that I would really like to impress, upon the audience here, is that the concept of doing well and doing good is not especially novel, right? But the time that we're in today, the point in history that we're in, the confluence both of technology, but also the desires of big capital, the desires of consumers, the desires of talent coming into the workforce, and really the assistance of government as well, have led to this confluence of events where there really truly is a unique opportunity now to make a tremendous amount of wealth creation whilst also doing a tremendous amount of good. And that is a thesis that's fundamental to our approach and impact. And I think just touching on our relationship with social finance, there's probably no one better to articulate that than Sir Ronald Cohen, who made this very point when we sat down together to discuss impact last year. So I'm going to play a short clip from that conversation.
If I were 26 today, as I was when I created APAC, I would be getting into impact VC and impact private equity. That's the new frontier, and that's where the real innovation is going to come in, and that's where the best returns are going to be achieved. That's where the money is going to flow. That's where the talent is going to flow.
So, 2 takeaways from what Ronald Cohen just said. One is that he started Apax, a global private equity powerhouse at 26 years old, which makes me wonder what I'm doing with my life. And 2, that impact is relevant for people today, right? That today, this is what he would be doing. It was not what he wanted to do or would have been doing then. And I can tell you firsthand that when he says today, he means in 2020, not 5 years ago and not 10 years ago. This is a picture of me in 2009 when I spent my junior summer at Penn in Bangladesh working for an organization called Grameen Bank. Grameen Bank are seen by many as the pioneers of the microfinance concept. The founder, Dr. Mohammed Yunus, won the Nobel Prize for it, and I went and worked for him for a summer. And I did so because I was inspired by Sarol's vision, one that I had known about for many years beforehand, and thought this was an amazing way to get plugged in. And after spending that summer on the ground in Bangladesh, lending small loans to small businesses, I thought this is something I want to pursue as a career. And when I graduated Penn, I actively sought out opportunities to go into the microfinance space because I thought it really coupled, doing well and doing good. And I went and had the opportunity to speak to Sarol about that at the time of making that decision. And he strongly urged me against doing so. He said that if you want to succeed in the impact field, you absolutely must go into the private sector, get well trained, get good skill set. And then once you've done that, you can step over and think about how to help others, much like I have done in my career, he said. And I took that advice to heart, and I have now ended up, in private venture investing, but obviously still staying connected to impact. But what's interesting is that when you ask him that question today, that's no longer his answer. Today, he tells people you absolutely can and should find careers in impact immediately, because now the base of talent is there, because now the skill sets are there, because now the money is there, because now the economic case for it is so strong and unignorable that he advises the best and the brightest coming out of the schools today that this is where they should be making their careers day one. And what I want to do for the rest of the presentation is really highlight companies that we think exemplify exactly these phenomena, right? Of all the confluences coming together to create an incredibly powerful value proposition. And perhaps chief among those to talk about is an our-crowd portfolio company in which we had a tremendous result last year, and one that I think really does typify what impact investing means to us, right? So this company, Beyond Meat, as you can see here, one of the most successful IPOs of the last decade, has an incredible fundamental value proposition and mission, right, around alternative meats. I think no need to elaborate on why that's amazing, both for the environment and for health and for sort of humane reasons. But also, when you look at what happened to this business, right, the desire of big capital to invest in this business was like something we hadn't seen before. The IPO book itself was 30 times oversubscribed, and you can just look at the chart and see the impact on the public market pricing that institutional pressure had. Obviously, from the consumer perspective, 84% of millennials today are saying that they want to find companies that have value alignment, that have a clear mission, right? And that's sort of, they vote with their feet. And Beyond Meat is very much a winner in that category. And then from a talent perspective, they were able to hire the best and the brightest coming out of schools like Stanford and Harvard to join the team at Beyond Meat, because this is where people want to be today. It is not the investment banks that they want to go to anymore. It is companies like the Warby Parkers and the Beyond Meats of the world that will give them that sense of value. So given that we are talking about Israel and Israel-focused businesses predominantly, I think that the remaining examples that we'll talk about are Israeli companies that have really exemplified this impact story. So here is one that Ariella actually mentioned in her opening remarks. It's a company of ours called Taito Care, and this is the personification of, or really the emblematic example of telemedicine. Okay, they give you a kit that you can see in this picture that you take into your home, and you can remotely monitor all of your vitals, check out all of your body parts. You can clearly see, what goes where from the picture here, and then share that information directly with your clinician, with your doctor, either on a live call with him or send him the results for him to relay feedback to you later. And you can see why in this environment in COVID, a business like this has obviously exploded. Insight Venture Partners just led a $50 million round into the company, and we're also co-invested alongside Ping An Insurance, the largest insurer in China, among many other great names. And this company again leverages technology that was just not available 10 years ago to go and do this, but the reach that they can have and the lives that they're saving by enabling remote monitoring is tremendous. And the next great example I'll talk about for a second is Rewire. So Rewire is really sort of disrupting the money transfers space. If you think historically, money transfers, remittance was really the purview of one business, of Western Union. There were a few other small players, but Western Union really has dominated this market for many years, and they charge massively high rates for an incredibly inefficient service, right? And so you have some of the world's most vulnerable populations trying to transfer money back to families in need in developing countries, and they are paying 8 to 15% on that money. In Rewire, you're paying a substantial fraction of that cost, and doing so with all of the security and high-touch usage of the best of modern technology. And in developing countries, the penetration rates of smartphones today are higher than they are in a lot of the Western Hemisphere. And so it actually, the system works incredibly well. And they're going after a multi-billion-dollar market here, right? Where if they get the market share that they're after, this will be an incredible venture-backed business, but only because it's able to leverage the best of the technology that's out there today to go and do it. And both Rewire in the fintech space and Taitocare in the healthcare space are finalists in the Extreme Tech Challenge. The finals actually took place last week. Neither company won, but they were the 2 Israeli finalists out of 6 total in this global impact challenge that has the likes of Jerry Yang, the co-founder of Yahoo, and Tim Draper, a well-known VC, who support this competition. And so it's really an impressive achievement. And the last company I'll touch on is one that's very, very dear to the OurCrowd community, because we've been in this business since the seed round. We've invested a tremendous amount of capital here, again, alongside some very impressive investors. But this business is at its core is a medical company, a medical imaging company that's disrupting the radiology space, right? The challenge today in radiology is that if I hurt myself, I hurt my leg, I go get a scan, I show it to one doctor, he thinks maybe it's fractured, maybe it's not. I go get a second opinion, I hear something totally different, and everyone is sort of staring at the image and making a best guess. It's a highly inefficient and expensive process, and can be made a lot better by training a machine who has seen millions of these images and can tell me with precise detail exactly what is wrong with my leg. And so Zebra does exactly that. And obviously the use cases for a company like this across medical diagnostic issues is massive. But it's just interesting where they've been focusing their time and their energy. So last year at our summit, Zebra announced a partnership with a group in Asia called Apollo Healthcare System. And Apollo run the largest hospital system in India. And Zebra is partnered with them in order to tackle tuberculosis in children across India. Now, the way that they test for tuberculosis today is that a child spits into a cup, and they examine that saliva sample to try to discern whether or not there is a future risk of tuberculosis in the child. This is the early prevention method that's used. It's an incredibly weak method, and obviously has not provided tremendous success in India. Zebra has partnered with this hospital system so that they can do imaging on children's lungs, and then read those images and do a much, much more effective way of testing and understanding this, which is obviously wonderful from what it will mean for children who could potentially suffer from this terrible disease. But further than that, what it does to Zebra's business, right? This is not a cute charitable play on Zebra's part. This is a wonderful way to go and acquire data. You have one of the largest hospital systems in the world where you are now going to open and access yourself to their data bank of medical images. What that does to feeding Zebra's engine, to feeding Zebra's models, to understand better how to go and build their own business and create more value for themselves and for their shareholders is huge. And so again, the advent of technology, the ability to scale globally, and the ability to now build businesses that can actually return huge sums of capital and wealth back to their founders are exactly the types of businesses that we are trying to back today in OurCrowd. And hopefully that gives you just a sense for where our head is at when we think about impact and the ways that investors can be participating with us. Thank you.
Thank you so much, Richard. The first question we have is, how does a social impact company decide on cost when there's a real need, for example, in medicine?
How do they decide on cost?
I'm reading, is there a different analysis for a social impact company when they're figuring out cost?
So it's actually, I mean, if I'm understanding the question correctly, it's actually a great one, because a lot of people look at the healthcare space and they assume that pretty much everything in healthcare is impact, because by definition, right, if you're treating and helping someone through medicine or diagnostics, that is making lives better and impacting people. We don't take that view. We think that, impact at its core needs to be able to prove that it's serving underserved populations or geographies, or fixing environmental issues that are causing suffering on an underserved level. And so price is probably the biggest problem child in that analysis, because it's very easy to create a great medical product that costs millions of dollars to administer, but that's going to be accessible to a tiny segment of the population. So what we want to see when we're investing in businesses is that they have figured out a way to bring down the marginal cost of their product, either by working with insurance companies, government, or otherwise, so that it is heavily subsidized and accessible. Otherwise, we don't believe that that's true impact.
I have one more question, which is I am familiar with socially responsible investing, which is often considered anti-Israel or tied to BDS. Is socially responsible investing and social impact investing related or totally separate?
They all exist on the same continuum, right? So at its, and there's, it's certainly a semantics game, but at its simplest, there's an idea called no harm investing, right? Screening out industries that you think are, from your portfolio, are doing harm in the world, right? So obvious ones like gaming, oil and gas for some people, anything arms related. That's filtering that out to begin with no harm. And then from there, you can layer on different terms and different screens and methodologies to try and tighten the good that you want to actually have and be more proactive in that search. So for us, when we think about impact, it's very much a high octane, very mission driven, very intentionally doing good, not just avoiding harm, where socially responsible tends to be a softer level on that same spectrum of thinking thoughtfully and consciously about your dollar beyond just profit.
Thank you. We are gonna move on to our panel, but Richard, I just want to say thank you so much for joining us. And to everybody, if you have outstanding questions for Richard, I know where he works. So feel free to email them to me and I will make sure he gets his answers to you. So thank you again, Richard. And with that, I would like to hand this over to my co-chair, Len Ferber.
Thank you very much. Bye.
Thank you, Amy. All my panelists can now come on via video. Terrific. Thank you very much. I am Len Ferber. I'm a partner at Katten Rosenman here in Chicago and co-head of our technology practice. I want to thank the Chamber for giving me an excuse to get into a shirt, tie, and suit today. I haven't been in one for about 4 months now. So I'd like to introduce my panel. First is Michael Lavin. Michael is founder and managing partner of the venture capital fund Germinate Ventures and an investor in the Israel-based company CropX, one of our featured companies today. Germinate seeks to improve the global food system, providing both investment and strategic resources to the founders of transformative food and ag tech companies around the world, like CropX. So here is a video on CropX.
There is a vast amount of untapped data below the surface of every farm. Data that has the potential to change how we grow our crops and in turn, how we conserve our resources and feed our growing global population. Introducing CropX, a platform that delivers the soil intelligence today's farmers need to reduce inputs, improve yields, and meet tomorrow's global food demands. The unique patented spiral design of the do-it-yourself CropX sensor make it easy to self-install in just minutes without disturbing the soil, thus significantly increasing accuracy beyond any other sensing technology. Combining soil moisture, temperature, and EC readings with a comprehensive big data analytics platform and advanced cloud technology, CropX delivers the most reliable soil monitoring system on the market. We help farmers cut costs, prevent runoff, and optimize crop yield. Farmers can create their profile, load their sensor data, map fields and zones, and take action in just a few clicks. Actionable insight helps farmers get more from their soil. Every crop, every field, no matter where they are. CropX, the Internet of Soil. More on cropix.com.
Our next panelist is Bernard Haston. Bernard is president of Speedread Technologies, a distributor of Israeli technology, founder of Israel Stake, which provides a crowdfunding platform to startups and established Israeli companies looking for capital or consulting services for the US markets, and a principal in the investment company RBJH LLC, through which he is an investor in another of our featured companies, Israel-based Insight Tech. Here's a video on Insight Tech.
Generally, people who have essential tremor start by taking medications to treat their tremor, but very frequently people can't tolerate those medications because of the side effect, and then commonly they don't take away very much of the tremor. MRI-guided focused ultrasound is a new way of treating patients with essential tremor.
The procedure is performed in the scanner, and as we're making the lesion, as we're gradually heating up the tissue, we can actually see the lesion being made in the patient as we're doing it. So it's real time. We've never had that before. The patients are awake, and we can evaluate them to ensure that we are not causing any side effects. What's quite remarkable with this is that we create the final lesion and the tremor stops. These are patients who have had tremor for 10 or 20 years that has just been very disabling. And they look at their hand and they sometimes think, is that really my hand? Well, I think it's just fabulous. I mean, I've done all the different surgical procedures for essential tremor, and this is by far the most elegant, safest, and effective way of doing it that I have seen.
Last, but certainly not least, is Bob Chibb and Ken Bach, who are co-founders and managing partners of Chicago-based Kaleidoscope Health Ventures, whose mission is to build a sustainable, healthy neighborhood and next-generation health innovation cluster. Since we don't have a nifty video to show, Bob and Ken, why don't we start off with you telling us about Kaleidoscope, and since we are the America-Israel Chamber of Commerce, connections between Kaleidoscope and Israel-based entities would certainly be of interest.
Yeah, absolutely, Len, and thank you very much for the opportunity to actually present to the AICC. Just for background context, Kaleidoscope Health Ventures is a venture development firm, as Len mentioned, with a mission to realize health equity for all by transforming really the healthcare innovation and reimagining sort of the healthcare delivery system. We're on this mission because Chicago's just got one of the nation's highest socioeconomic life expectancy gaps, and that's 30 years. 30 years between higher income and lower income neighborhoods, right? So we believe that your zip code should define where you live, not how long you live. And every neighborhood really should deserve equal access to quality as well as affordable care. And as you can imagine today, healthcare innovation is even that much more imperative than ever before. COVID-19, if it's done anything, it shed a bright light on the fact that health disparities in underserved communities, as we're seeing, more people tend to be exposed to and dying from coronavirus in these lower income communities. And we can solve for this. You know, Chicago's got all of the natural ingredients to lead the way in healthcare innovation. We've got significant NIH funding for basic science and research, 3 top tier 1 universities, 2 national laboratories, the #5 producer of STEM degrees in the US, and a very diverse patient population. However, we tend to punch below our weight when it comes to addressing health disparities and the underlying economics and the environmental conditions to improve the overall longevity in these underserved communities. So last year, Kaleidoscope Health Ventures actually partnered with Farpoint Development and GRIT on a planned 100-acre development in Bronzeville to bring together the overall community, academic institutions, biotechnology firms, entrepreneurs to collaboratively form what we're calling a global health and wellness innovation hub that's designed around creating new approaches to healthcare, wellness, and longevity. On March the 12th, so just earlier this year, pre-COVID, in terms of everything getting shut down, we announced that the ARC Innovation Center, which is the innovation arm of Sheba's Medical Center, which is also Israel's national hospital and currently ranked number 9 hospital in the world, will be the first tenant for the first phase of this healthcare innovation hub at the former Michael Reese Hospital in Bronzeville. And this innovation arc is really well known to fast track technologies developed by Israeli entrepreneurs and innovators and bring new technologies to the marketplace. And our collective vision with Sheba Medical Center and Farpoint Development and Grit is to build a sustainable, healthy, and wellness community, and really a world-class health innovation cluster, promoting inclusive innovation, workforce development, and new health solutions that address health disparities and drive wellness and longevity for all Chicago residents. And we couldn't really think of a better place to do this than on the former Michael Reese site, which was also very much known for its openness to all people, regardless of religion, race, nationality, sex, or income. And so we're excited to make this announcement and bring a lot of our discussions with Sheba Medical, with the Perez Center of Peace and Innovation, and with the strategic innovation ecosystem here in Chicago to address some of these challenges.
Thanks, Bob. Michael, can you tell us a bit more about CropX, including highlighting connections it might have to the Midwest?
Sure, I'd be very happy to. Well, we all saw the video. CropX is really the only do-it-yourself smart sensing solution that's retail ready and affordable on the market today. And it's the most precise technology. In fact, the sensor is really a software company is the way we look at it. And the sensor was built with the mind that there just isn't a sensing solution that is capable of generating the data that we need to power.
Looks like Michael may have frozen a little bit. Michael, are you there?
I apologize. I cut out. What was the last that you heard, Len?
Good point. I can't remember.
All right. Let me start over. Okay, let me put it this way. So CropX is often referred to as a sensor company. It is not a sensor company. It is a software company, big data platform that basically gives the soil a voice. So you can layer satellite imagery with in-ground sensing and a number of other data sources to precisely predict where the field needs irrigation, where it needs nitrogen, and actually we're stacking on a number of other new farm tasks related to this. So it's going to be a total digital agronomy platform. But like I said, oftentimes connected with being a sensor company, we have a sensor or CropX has a sensor that it has built, but it built that sensor because there wasn't a sensor on the market that could pull the data that we needed to power the software and data side. So it is really a software and analytics company, but with a lot of investment and man hours and innovation going into this sensing capability. And what we have today is the only do-it-yourself smart soil sensing solution that takes data from the ground, which is quite frankly where all the stress in the field begins anyways. You're capturing data from above ground from satellite imagery. It's usually too late already to make any sort of decisions and act upon it. And that's very different. It's a very different value proposition for farmers. And we really, at Germinate, we appreciate the fact that this is retail ready. It's do it yourself, it's very affordable. And the company is really exceptional at putting the user at the center of this impact and value proposition.
Thank you. Bernard, let's turn to you. Can you tell us a bit more about Insight Tech or other social impact companies you may be involved in, again, highlighting connections to the Midwest?
Sure. Hi, everybody. So Inside Tech, which it didn't really come across on the video perfectly, but let me just add another sentence about Inside Tech. This technology is basically surgery without a scalpel. And the video that you saw is with a person that has essential tremor, which is an effect of Parkinson's disease. And the Israeli technology from Inside Tech is curing people. And when you saw at the end of the video, the man where he's not shaking anymore, this is an FDA-approved cure for people with Parkinson's essential tremor. So the company today is trying and doing a great job of rolling out this technology, and it's an attachment to an MRI machine. So if you have an MRI machine in a hospital, something that can be attached to it, and you can start treating people with this disability. And in the Midwest specifically, Chicago already has one location. Rush University Medical Center has it. They would love to have more locations set up throughout Chicagoland and more hospitals. And Indianapolis has one, Minnesota, Nebraska. In fact, the Nebraska Center at St. Mary's, they are taking patients nonstop. Even before COVID, yes, there was a delay, but what I was told this morning is that at St. Mary's in Nebraska, they're doing 3 to 4 patients a day, every day, 7 days a week that have these disabilities. In Ohio, it's at the Cleveland Clinic and at Ohio State. And right now the system is in 22 countries around the world, and they can't make the machines fast enough to get them out. And one other comment, and what I mentioned is essential tremor from Parkinson's disease, but there are now four procedures that are being done with using this technology. And let me back up for a second. The system is called focused ultrasound, doing surgery without a scalpel using the MRI machine's ultrasound. So they're doing brain surgeries. They're now doing people with cancer, brain cancer, where, like I said, you don't have to cut, no incisions. They're using this focused ultrasound machine to do it. They're doing bone cancer, and they're also doing, and this is something for Bob and Kenneth, uterine fibrosis, which is a cyst on the uterus, and it happens more often with African-American women. As opposed to doing a hysterectomy and cutting someone open, you can actually do this procedure and get rid of the cysts and the cancer spreading in the uterus. So just something to mention there. And the most exciting thing, and the last thing I'll add about Inside Tech, they are finalizing getting FDA approval on the procedure for opening the blood-brain barrier. This is something where it helps medicines. Right now the barrier is set up so you can't get medicines into the brain. You can't do much there, but this technology has been proven effectively to open up the brain long enough to get medicines inside. And if you look at the videos that they're showing now, they're doing it on human trials on people with Alzheimer's. And this technology has been already effective, and it's going through the process. So amazing, amazing social impact technology, because as they show on Star Trek, you want to heal people with just scanning them, and that's what this focused ultrasound does.
Very interesting. I sort of now want to spend a little time focusing on creating social impact companies. And so Bob and Ken, what drove you to form Kaleidoscope? Were you motivated to address a societal problem, or was it just more of a natural outgrowth of perhaps your professional backgrounds?
So for both Bob and I, the answer is it's a combination of both. The societal problem is what Bob alluded to before, which is, Chicago, we're known for world-class architecture, jazz, academic medical centers, but we're also known for the largest life expectancy gap in the country, 30 years. Just kind of think about that for a moment. In Streeterville, residents live to 90, but then just a few miles away in Englewood, it's 60, and it's not due to violence. 30 years in a major metropolitan city in the United States of America in 2020. So how can we address this? How can we as Chicagoans gather our best, recruit what we were missing from the rest of the globe, and then create this special innovation ecosystem to grow our solutions for our own health and ideally chip away at this 30-year delta? So first and foremost, yes, this societal problem. And then the natural outgrowth of our professional interests. Bob and I, we spent our careers in healthcare innovation, from venture capital to startups to leading global pharmaceutical giants. And over that time, we were students of different approaches to innovation. And most recently, we focused more than a year of our lives visiting and researching, the well-known innovation centers, San Francisco, San Diego, Boston, the secondary innovators such as Montreal and Denver, and then asked the question, are there other areas where innovation usually takes this much time and this much capital, and now is this? And the answer to that, of course, is NASA versus SpaceX and Blue Origin. And then we integrated all these learnings into a unique innovation platform that pulls in a pipeline of leading global startups, starting with those from the innovation leader, Israel, focused on enabling better health for all. And then it's physically anchored on this 100 acres right on the lake. So for Bob and I, Kaleidoscope was formed to address the societal problem by leveraging our professional interests as well. And I know Bob has a very personal story as well.
Yeah, I do. And I think that was actually very well said, Ken. For me personally, about 2 years ago, I was involved in producing a film about a 69-year-old Black man, veteran of the military. He lived in a lower income community, suffered from bipolar disorder, cardiac issues, and he was on a life alert. His life alert was accidentally triggered at around 5:22 a.m. And the police were first responders to show up, and by 7 o'clock, he was actually shot dead. And it's a true story. It happened to a man by the name of Kenneth Chamberlain Sr. in November of 2011 in White Plains, New York. But his story really changed my life because I became very, very curious around how race, class, mental health really have an impact on our society at large. And the communities in which we are born, which we grow, learn, live, work, age, they all play a very significant role in our overall health and life expectancy. So, as Ken mentioned, it was definitely partly what we saw as the sort of the Chicagoland sort of landscape, not just locally, but around the US, but then also that personal experience with having to tell this man's story.
Michael, sort of the same question for you. Thinking about both CropX and Germinate, the focus creating and funding companies to solve a particular societal problem, or does it just happen to have an interest or background in a field that can be characterized as social impact?
Yeah, I think it's a great question. I'm glad you asked it because it is one of our key differentiators. I'll start by saying that our fund is very unique in several ways. One is that we have very significant strategic backing from the food and agriculture sector all throughout the value chain. And I have deep roots in the sector. But the reason I started Germinate 3 years ago was really an impact motivation. And the way we think about impact is in 3 core pillars. It all starts with basically, on a foundation though, that recognizes that food and agriculture is the #1 lever for impact, for catalyzing health on Earth, for regenerating the Earth system. And that leads into where the pillars are. So food security is a problem that was touched on in the video, if anyone caught it. The future population is going to be about 10 billion people by 2050. And we have to increase food production by 70% in order to meet that demand. That's the number that's published by the UN. That number is wrong because actually if the non-Western nations and societies start to consume like we do, then that number is probably 5x. But, and that's a pattern that's happening, by the way. So food security is a big piece, nourishing the planet more wholesomely, because there's a lot of people that are still going hungry everywhere, even in our society, obviously. And using food as medicine. So that's really all in the first pillar of nourishing humanity, basically. Second pillar is is tackling climate change. And agriculture is a big burden and offender of climate. And it's also a huge opportunity to sequester carbon and greenhouse gases and reverse the trends and actually regenerate the Earth system very meaningfully. And I'm not talking moving the needle incrementally, but actually very significantly. And the third pillar, Leonard, I see you want to say something else. The third pillar, real quick, is making this all economical. And that touches on a point that was raised earlier, that we don't invest in technologies or companies that just have an impact proposition. They have to be lifting up the key stakeholders very significantly. That's what drives the adoption. That's what capitalizes on network effects. And that's what drives the meaningful impact. So ensuring that there's a prosperous food system that is enabled through this impact, through these technologies, is a key piece. These are all pillars that are must-haves in every company that we invest in. Most companies do not check these boxes. So, you know, thinking with that framework actually makes our job quite easy.
Bernard, do you think that there's something particular about Israeli companies and their focus on social impact? Are they uniquely situated in your view?
I mean, absolutely. In every experience I've had with Israeli companies or Israelis in general in business, in the business world, they're always looking to innovate. They're always looking to take something and make it better, make it more efficient, make it more ready to be used. They spend a great deal of time engineering new ideas and new products. I mean, I've seen some great technologies out of Israel. And of course, in our family's opinion, InsideTech was one of those to really change the world. And that's what Israelis like to do. What we are trying to do is try to help them get those products into the marketplace, bring them to the United States, bring them out to the marketplace, because a lot of times you see the Israelis fine-tuning, making better the system, but they have a little bit of a deficiency, no offense to any Israelis, but in getting it out to market, getting it out there. So we're trying to help them as much as we can. And they literally, it's just wonderful to see how they impact, whether it's medical technologies or in CropX and in farming, how it's now a better option not to make an incision to cut somebody in a surgery, use a focused ultrasound as an alternative. And that should be the standard for what happens going forward.
Now, Michael, I know that you've got a hard stop for us, and I understand we have one question that came in specifically for you. So Amy, you have that question for Michael?
So thanks. Yeah, we do have some questions. I'm not sure I'm going to be able to get to all of them, but Michael, the question is for you, is that there's a lot of talk about feeding the hungry, but we also have a problem with obesity. And when it comes to impact investing in food tech, is there just as much of an effort focused on low-cost food that's nutritious and not just feeding the hungry?
Yeah, absolutely. First of all, obesity, we all know, is a huge problem. There's a lot of stats floating around. One that really is bothersome for me is that 3 out of 5 American kids are meeting the definition of being obese. That's awful. And that's an opportunity for healthcare down the line, but that makes healthcare sick care. So, you know, I think that this is an important space to focus on, is an important problem set. The answer to your question is yes, we are actively investing in that space, thinking about those problems. And one company that is in our portfolio that we're very excited about is called Brightseed. This is the pinnacle of food as medicine. What they're doing is they're combining AI with bioinformatics to rapidly screen and discover plant-based compounds that map to human health outcomes, such that if we put this in our diet, and it's already in our diet, that's the thing, is a lot of these foods are already in our diet, these plants are in our diet, but we're not getting the actual dosage we need on a daily basis for it to take the effect that actually it can promise and deliver. And so with this platform, we're able to find where those compounds exist in nature, or phytonutrients exist in nature, but not just nature, also well-established commercial supply chains, so we can get this through extraction to market quickly with the right economics and put it into the many different food products and beverage products that we consume daily and habitually that are actually, were at one point the cause of the problems that we have today, and being obesity and diabetes and liver disease. These are hugely, front-running disease, chronic disease areas, to making it actually the solution through food. So that's one of the companies in our portfolio. We invested in that company in the seed stage with Horizons Ventures, which is Li Ka-shing from Hong Kong, his private investment arm. We brought in a number of other great investors to join our syndicate. The company is doing phenomenally well. They have partnerships with leading food companies, many of whom I can't name, but I can mention Danone, who's searching for everything that is great in soy. And remarkably, there is a ton of untapped potential in just soy, even though there are some counter trends on soy right now. It's amazing.
Bob and Ken, before I know we're going to go to some questions, but I wanted to talk to you or have you talk about business models for social impact companies, specifically, for-profit or not-for-profit. I know that you guys have some definite opinions about that.
Just want to say thanks, everyone. I'm jumping to a CropX board call, but nice meeting everyone.
Thanks, Leonard. The deeply unsatisfying answer is it depends. And oftentimes the answer is a combination of both. So, for example, I worked in family offices leading venture, philanthropic, impact investing efforts. And the families made their wealth in one industry. And then someone they love became sick, and they quickly realized you can't throw hundreds of millions of dollars at something and make it go away. So we applied both for not-for-profit and for-profit levers. Obviously, the not-for-profit grants were provided to scientists and clinicians to push that basic science forward and to really evolve the science to a point that commercialization can start. For something to be a solution, though, for patients at scale and sustainable, being defined as continuously available, it really needs to be commercialized, which implies for-profit incentives. And we all know modern medicine works in this way. Basic science funded by nonprofits, i.e. the government, NIH, BARDA. Then this science is spun out oftentimes through the transition of tech transfer into a for-profit entity, the startup, whose job it is to continue to develop the drug, diagnostic device into something valuable to the market. And to be sustainable, someone has to make money and have the incentive to keep producing it. Now, looping this back to where we began, our lakefront development is also a combination of not-for-profit and for-profit. Our goal, overarching by far, is to enable and improve health for all, health being more than just biology, wellness, social determinants of health. And we're catalyzing these innovations that enable and promote good health, attempt to bend cost curves and improve access. And thus there will be nonprofit components to support kernels of ideas as well as programs. And for these for-profit efforts, there's a for-profit angle and approach and support to grow these startups into sustainable, scalable producers of solutions to improve health. So to loop all of these vignettes together, an ideal not-for-profit will be mission-driven, supremely capital efficient, and ideally not distracted by the profit motive, thus achieving its goals more quickly. But that being said, these three statements should really also apply to for-profit entities. And in our opinion, the best social impact models, they're really combinations of not-for-profit and for-profit. But in this case, where the goals are both deeply aligned in the same direction.
I'll get Amy back on. I think that we have a number of questions for all of our panelists. So Amy, take it away.
Thanks, Glenn, and thank you to our panelists. And I know we want to be sensitive to everybody's time and wrap up when we can. But question is I have two questions. Bernard, maybe you can answer both of them. What are some of the obstacles InsideTech is facing? And I know you mentioned a few locations, but how can somebody find where this technology is available?
To find the technology, go on the website, insidetech.com. Maybe Amy, you could send a link to everybody who's on at some point, but insidetech.com has locations around the United States, has it around the world. But the biggest challenge that they have right now, in my opinion, is they can't make these machines fast enough and get them deployed in every single hospital around the world, which is the hopeful goal of the company, anticipated goal. But I mean, they have enough capital today. I do want to mention Our Crowd is a partner in InsideTech from the last round. And the biggest investors today in InsideTech are the Koch brothers. The Koch, it's actually the kids of the Koch brothers from Kansas, and it's under Koch Disruptive Technologies. They're looking around the world for companies that really disrupt the marketplace. And they saw InsideTech in terms of not needing surgeries with cutting as the real deal when it comes to medical advancement. And they've invested a total of $300 million into this company. And they're using the money today not only to brand it, not only to market it, but to manufacture it, which the manufacturing is still all done in Israel, and get it out into every country, every medical facility possible. So that's the challenge the company has right now.
Thank you. I have a question for Ken, which is, how are ways that companies who have a nonprofit arm that supports R&D that eventually gets commercialized under the for-profit arm to give back to the community that supported the foundational work? Is it by staying local? Is it by giving jobs?
Sure. So let me answer that from two perspectives. The first one is in our specific field, and let's take the example of diagnostics. There are a number of diagnostic platforms that have actually been given massive grants in, let's call it, emerging markets, for emerging markets. And what they've done is they've actually used those immense sums to drive down and develop the cost of their functional platform. And then what they do is they take those bending of cost curves and apply them to the US market and the clinical market, which in the end should decrease the overall average selling price of the actual unit, and therefore ideally make it more accessible. There's a lot of nuance in that, but that is an example. Drilling it down to, or bringing it back to what we're talking about in terms of the 100 acres, let me just tell you a specific story that has to deal with me. I grew up in Lockport, New York. Never met anyone who has any idea where that is. It's outside of Buffalo. Small town, no traffic lights. But I'm here on this call. And the reason I'm here on this call is because of Mr. Mayor, of Sister Angela Marie, and 3 other people, as well as my parents, who gave me nudges along the way and showed me what life could be. So it's really important to us, and one of the really great reasons why really important reasons why we are fortunate enough and chose Farpoint and the GRIT group to work with is they also have that same commitment and dedication to exposing the neighborhood and, more importantly, connecting the neighborhood into what's going on. So drilling back to my personal story, one can imagine that there's a child in that neighborhood who would not normally be exposed to next generation sequencing, or quite honestly, see someone, an entrepreneur, build something out of nothing. And so, yes, in order to circle back and provide that value to the community, it is something that you have to be A, committed to do, which we are, and B, spend money, time, effort, and planning to enable that interaction with the community.
So I have, I'm not going to get to everything. I have one last question. Just a reminder to everybody that if you have questions, either that didn't get answered or that you think of afterwards, please feel free to email me and I will make sure the questions get to the appropriate person. And after this last question, I'll turn this back to Len, but I just want to again say thank you to everybody for joining us today. And for those of us that support Israel, I hope you can walk away standing a little taller, knowing all the amazing things that Israel is doing at a crucial time for the world right now. So the last question is to Ken or Bob, and it's whether or not Pastor Harris, who many know as a champion for both Israel and Bronzeville, has been involved with you guys.
Yes, actually, we've talked to Pastor Harris on a couple of occasions, I think as early as mid to late last year, as well as early this year. He's done a lot of work, not just with the Israeli innovation ecosystem, but also with the Perez Center of Peace and Innovation, where he's taken a lot of the learnings from, how the Perez Center has worked with trauma and really brought some of those learnings right to the Bronzeville neighborhood. He is certainly a core part of who we are engaging, especially within the Bronzeville community. We've been working also closely with the local alderman as well, Alderman King, and collectively, I think Pastor Harris has also served as one of the advisors to her advisory board for this overall lakefront development. So we've certainly gotten his input. He was actually, when we were going to make the announcement, the initial intent was when we were actually going to sort of announce on March the 12th, that was ultimately going to be a series of public events. And one of them was early in the morning, a breakfast event where we're going to have a series of speakers, and Pastor Harris was actually going to be one of the speakers coming in and really talking about the impact that he saw a development like this happening with the overall Bronzeville community at large, and some of the positives that he saw. So unfortunately, we weren't able to hold that event, but we hope that when things open back up, is that we will be able to hold a public event together, and Pastor Harris will certainly be there to talk, provide his perspective on not just the Israeli innovation ecosystem, but also the work that he's doing with us on this Bronzeville lakefront development.
I think we are now up against our time, so I want to thank our panelists, Bob, Ken, Bernard, and Michael for their time today, and we'll turn it back over to Scott to close out the event. Thank you all.
Thanks, Len. Thanks, Amy. Thank you, panelists. Thank you, Ariella and Richard. This was a very interesting program. For those of you who aren't familiar with the activities of the Chamber, we work with companies, early stage companies who are in need of resources, who are in need of introductions, whether it's for marketing, for key personnel, for funding. This is what we do, and frequently in conjunction with the Consul General's office and Ariella and Aviv Shelgi, from there. So I want to remind you that I encourage you to join the Chamber. I encourage you to lend us your financial support, which everybody needs these days. I want to thank you all for attending, and we'll look forward to our next program with you. Thank you again.